Hello, this is Dr. Paul Ingmanson. I'm the Director of Sleep Laboratory Services at the VA Hospital in San Antonio, Texas. And I'm here to talk with you today about healthy sleep and how you can get the best rest of your life for the rest of your life. In part 2 of this series, we're going to talk a little about what we do to diagnose sleep problems. There are a number of techniques that we can use in order to understand how people's sleep is impaired and what we can do to help people with sleep problems. Now, please take out a pad of paper for your use during this series. First of all, of course, there's meeting with your doctor and having a discussion about your sleep problem. Usually the place to start will be having a discussion with your primary care provider. Also, there are a number of questionnaires that doctors may use to help assess people's sleep problems. Let's start with an example of a questionnaire. This is a very simple questionnaire called STOP. It only has 4 questions, yes or no, and it will take about 1 minute to complete. So write your answers down on the pad of paper you took out from part 1. There are just 4 questions. Question number 1, do you snore loudly? That would be louder than talking or loud enough to be heard through a closed door. Answer yes or no. Question number 2, do you often feel tired, fatigued, or sleepy during the daytime? Again, answer yes or no. And question number 3, has anyone observed you stop breathing during your sleep? Yes or no? Question 4, do you have or are being treated for high blood pressure? Again, answer yes or no. If you answered yes to 0 or 1 question, you are at low risk for breathing problems during sleep. If you answered yes to 2, 3, or all 4 questions, you may be at increased risk. Of course, no questionnaire is perfect. Some people who answer yes to none or just one of these questions might have a breathing problem during sleep, and some people who answer yes to 2, 3, or 4 might not have a problem. And of course, there are many other sleep problems. But this is a simple way to start your self-assessment for one kind of very common sleep problem, breathing problems during sleep. It may be helpful to save your answers here if you're planning to discuss your sleep in a future visit with your primary care provider. So what's next? In many situations, your primary care provider may have suggestions for ways you can improve your sleep patterns without going for any further tests or visits with a specialist. But there are other situations where sleep testing may be recommended to help understand your sleep problem and your sleep physiology in more detail. We have a couple of different techniques we use to do this. Most of these techniques involve things like putting little sensors or wires on your body to measure different physiological functions. Most people do not look forward to getting a medical test like this poor fellow here, but sleep testing really is painless and is not as uncomfortable as you might think. There are several different ways sleep testing can be accomplished. It can be done either in a sleep laboratory or at home. When we do studies in the sleep laboratory, we have a technologist that is generally in a room next to the bedroom where you sleep. Most sleep labs are designed not like hospital rooms, but more like hotel rooms to increase your comfort and make it easier for you to fall asleep. We don't stick you with any needles. We tape wires on the outside of the body, but these are non-invasive because we're trying to observe your sleep in as close to a naturalistic situation as possible. People generally come to the sleep lab in the evening for a sleep recording, and they depart the next day in the morning. There are many different signals that we look at when we are monitoring sleep in the laboratory. When we do a sleep study, we are making a recording of what happens in your body overnight. We call this recording a polysomnogram. Let's break that word down. First, poly means many. There are many signals that are being recorded. We observe the heart rhythm, we observe brain waves, and we measure your breathing over the course of the night. We also look for abnormal movements in your arms or legs during sleep. Somno means sleep. So we're monitoring all these things generally during the night when people sleep. REM, of course, means a recording. We're observing these signals, and we make a recording, generally 6 to 8 hours, of what's going on in your body overnight as you sleep. The signals we measure can tell us something about whether sleep is normal or abnormal, and give us an idea of whether there are medical problems during sleep that we cannot measure when you're awake. In addition to sleep testing that's done in the laboratory with a technologist observing the patient sleeping, we can also do sleep recordings at home. There are several different kinds of instruments we can use at home, but generally sleep recording at home is done to look at problems with breathing during sleep. There are many other sleep problems that can be studied, but in a home environment, we're generally looking at a set of signals that are associated with breathing during sleep. Here's an example of one form of instrumentation that we use. This is a patient that's asleep at home with a home recording device. The devices that are used at home for sleep studies are simpler than what we measure in the laboratory. So in most cases, when we study sleep at home, we are not measuring things like brain waves, but we are measuring breathing, heart rate, and oxygen levels during sleep. Here you can see the recording device strapped around the patient's chest. In this case, the patient has a little plastic tube fitted up into the nose. This is called a nasal cannula, but in this case, it's not providing oxygen. Rather, it's actually measuring airflow in and out of the nose. Also, there are signals that are obtained from a belt around the chest that tell us something about breathing activity during sleep. And finally, we have a pulse oximeter. This is something you probably have some familiarity with. Most times when you go to the doctor's office, when they check your pulse, they also check your oxygen with this little clip placed on your finger called a pulse oximeter. That's a common feature of many overnight sleep recordings that are done at home. There's a pulse oximeter that measures the oxygen in your bloodstream as well as your heart rate. And so these are some of the signals that we are monitoring when a person takes a sleep test at home. Here's another example of a home sleep recording device, and this is a very simple device. This particular device is worn on the wrist. There's a little probe on the finger there that measures blood pressure, and another probe on another finger that is measuring oxygen levels. This is another way to record sleep at home. Again, this kind of a setup is designed to test breathing problems during sleep only, and it's not going to tell us something about abnormal movements during sleep or what the brain is doing during sleep. So signals that are recorded on a home sleep study are simpler than what we observe in the laboratory, but they're very helpful when it comes to observing a person in their home environment. They're very helpful specifically to answer questions about whether or not patients have breathing problems during sleep. So home-based sleep recordings can tell us one thing pretty well, and that's whether or not you're having breathing problems during sleep. But they don't address all the other possible sleep disorders that we might be interested in studying. In the laboratory, we have a technician present who will place sensors on the scalp to measure your brain waves, as well as other sensors on different parts of the body to measure things like abnormal movements during sleep. Also, in the laboratory, we will generally obtain a video or recording of your sleep. The video can be very useful when we are trying to measure movement activity during sleep, and video is not available on most home sleep recordings. Now, please take a minute to write down on a pad of paper 3 things that you've learned about from this part 2, or 3 things that you learned from watching other sleep videos in the VMC library. As we can see, the diagnosis of sleep problems is painless. Sleep recordings at home or in the lab are designed to measure your sleep with a minimum of discomfort in as natural an environment as possible. Home sleep testing is often a very useful first step in determining if a person has breathing problems during sleep, and laboratory testing, either as a first step or in follow-up, can provide more information covering a variety of different sleep problems. Be sure to watch the other videos in this Sleep 101 series and check out additional information about healthy sleep and how to get it in the VMC library. Thank you.